Hi, I'm Sophie, nurse practitioner at Turner Medical Arts. These short episodes are all about real women's health and my clinical experience and knowledge. This is a channel where I talk about all things hormones, perimenopause, sexual wellness, birth control, weight support, and everything explained simply without the confusion. Let's dive in. Hi, it's Sophie, nurse practitioner, and today I'm going to be talking about a very frequently asked question. And this question is about vaginal estrogen. So many women, especially those who have been on hormone replacement therapy or just those who are experiencing vaginal atrophy, which is when the tissues of the vaginal area get dry from low levels of estrogen and very sensitive. So, a question that I get asked is, can I use vaginal estrogen if I'm also using another form of estrogen? And it's a great question because the big thing in hormonal therapy that we worry about is unopposed estrogen. So, having high levels of estrogen that could potentially thicken the lining of the endometrium and cause problems. So I love that people are asking this question, and I'm here to shed some light. So yes, it is totally fine to use vaginal estrogen together with other forms of estrogen. Many people are on a patch, so that means that you can use your patch for estrogen and you can also apply the lotion topically. So the reason for this is because when you're using a transdermal, a patch, a cream, whatever it is, of estrogen, that goes through into your bloodstream and it alters your blood levels. The transdermal cream, so the cream that's going inside of the vaginal area, is actually different. So it does not really change your blood levels at all. So that is why it's safe to use together. It doesn't change the blood concentration, so there's really no risk of using it vaginally. And a lot of people say, I'm not sexually active, so is this really for me? To those patients, I just ask, is that area ever sensitive? Is it ever uncomfortable? Do you have urge incontinence? And that's a type of urinary sensation that when you need to go, you absolutely need to go, and it's an emergency. So a lot of people have all of those things, and that's really what this topical cream is great for. It helps restore the moisture, and it helps replenish those cells that have been depleted from the low levels of estrogen. So this is a cream I usually tell people, throw the applicator away, put about a blueberry-sized amount on your 2 fingers, put it around the vaginal area, around the urethra where urine comes out, and then into the vaginal canal. And by doing that, you're really helping replenish all of those cells that have gotten really atrophic, so they've gotten really dried out and sensitive over time. It's a lotion that sometimes for the first week or 2, I'll have patients use it nightly, depending on how severe their symptoms are. And then following that, they can use it 2 to 3 times a week. So apply it 2 to 3 times a week at night. And it's so helpful. It's really overlooked. And I'm glad people are asking this question. And I really hope that more people will consider it if they're having these type of symptoms.